Foundation, which has provided funding that is supporting not only this program, but the other two programs in the Seeing LGBTQ Nikkei series. I want to give a shout out to our community partners. These are community organizations that are spreading the word about these programs. And I especially want to acknowledge Keisuke Lee Miyake, who's with the San Francisco Buddhist Temple LGBT group, and Kei Matsuda, who's with Sanjin Okai and is also on the board of directors of J-Sei. So today's program kicks off a second series of programs related to the virtual exhibit Seen and Unseen, Queering Japanese American History Before 1945. And that is online till June 30th. I encourage you to visit the exhibit if you haven't already seen it. And the exhibit is also in Japanese, and it's been translated by journalist Asako Hanafusa, who's on this Zoom call. And the exhibit reveals a hidden history of same-sex relationships and gender nonconformity, especially among early Japanese American immigrants. The first set of programs related to Seen and Unseen really focused on Japanese American queer history. And this new set of programs really focuses on contemporary LGBTQ identified Japanese Americans. Now, many of us who identify as LGBTQ+ and Japanese American, especially those of us who are on the older end of the age spectrum, have felt for most of our lives that the larger Japanese American community has either aggressively ignored or actively attacked our sexual orientations and gender identities. And that's compelled many of us to either not be involved in the community, leave the community, or to hide certain aspects of ourselves. So today's program is really an opportunity for us to make the full spectrum of our identities and their complexity visible. And this afternoon's program is moderated by Eric Arimoto, who's going to introduce our panelists. And Eric is like my long lost gay sibling. We were both raised in Southern California in the 1960s and 70s, but we didn't meet until about 5 years ago through the Okaeri Planning Committee, of which Eric has been a leader since Okaeri's inception. Eric is a psychotherapist who has a private practice, and he also works with the Los Angeles County Department of Mental Health. As a young man, Eric experienced homophobia in the Japanese American community, which compelled him to not only leave the Japanese American community, but also Southern California, and he joined the Army right out of high school. And in the subsequent years, he's since returned to the Japanese American community to our benefit, including his involvement through Okaeri. So I will pass the baton to you, Eric, to introduce our speakers today.
Wow, thank you. Thank you, Stan. That was amazing. I have nothing else to add to that. I want to thank Stan and Jill for this opportunity to moderate this panel. I think it's so important that we reclaim JA LGBTQ history, and I just want everyone to know we're making history, you know, and stitching together these communities and our identities and biracial JA folk and whatever generation you're from and what language you speak and, you know, what your parents know about your other life and your other identities, right? And I think nothing but good can come of these activities. So I'm so incredibly proud. And I had something planned, but Stan, you covered it all. And you are my long lost brother. And it's a little uncomfortable meeting your long lost brother, you know, through an activist group and going, where the hell have you been? And why don't we know each other? And why aren't we supporting each other? And why haven't we gone through the coming out process together? And why haven't we gotten stronger together and survived AIDS together and COVID together, right? So that's how much it means to me. I'm very touched to be here. And I think it's so important that we do this work. With that said, I just threw up my entire script. I just want to encourage everybody to vigorously use the chat. Michael Matsuno has generously offered to monitor the chat. So especially if you're LGBTQJA, please feel free to chime in and share your experiences. If you have a question for a particular panel member, we'll hope to get it to them, okay? And they'll respond to you. So please use the chat. I also want to thank Corey Dosti, our captioner, right? So I think it's amazing that we have a captioner for all of our events now. And let's see. That said, I'm going to introduce all of our panelists, okay? And just bear with me, I'm going to read because there's no way I could memorize this. Okay. Robert Nakatani was born in Honolulu. Robert, you want to like wave your hand or something? I can't see you, but you want to, if you speak, your screen will pop up for everybody. Oh, wonderful. Robert was born in Honolulu, Hawaii, to Nisei parents. He identifies as a gay Japanese American man. Robert worked as an estate planning and civil rights attorney in a small firm in the Castro district of San Francisco during the 80s, and the majority of his clients were people with HIV. Robert later worked with the ACLU of Northern California Unity until he retired in 2015. For the full bios of all of our panelists, you go to the top of the chat and there's a link. So if you want to read up on all the panelists, please feel free. Thank you, Robert. Kris Mizutani is a registered nurse and PHN, public health nurse. Caring for people diagnosed with HIV/AIDS. Oh, no, sorry. Kris started her career in the Bay Area as a nurse caring for people diagnosed with HIV/AIDS, which shaped her entry into acute care nursing. Kris works with dual and triple diagnosed clients in the San Francisco shelter healthcare system and emergency department, and has a unique vantage point of being involved in the response to both pandemics. Kris also serves on Okaeri Connect's planning committee. Thank you, Kris, for being here.
Thanks, Eric.
Lance Toma is the CEO of San Francisco Community Health Center since 1999. Under Lance's leadership, the San Francisco Community Health Center transformed into its current brand after a 30-year history of being known as Asian and Pacific Islander Wellness Center, or API Wellness. And in 2015 became the newest federally qualified health center in San Francisco in over 30 years. Lance is passionate about his work in service of the API, LGBTQ, HIV, AIDS communities and people of color. Lance was recently appointed by the California State Senate to serve on the Commission of Asian Pacific Islander American Affairs. Thank you, Lance, for being here. And our final panelist is Lisa Fujie Parks. Lisa is a multiracial Japanese and white queer parent who lived in Japan for part of her childhood and lives in Oakland, California for the past 25 years. Lisa serves as the board co-chair of Our Family Coalition, a San Francisco Bay Area nonprofit that advocates for equity for LGBTQ families and children through support, education, and advocacy. Thank you, Lisa, for being here. And Lisa had a special request to start our panel, the moment of silence. Lisa, do you want to do that?
Hi, everyone. It's such an honor to be here with you. Thank you, Eric, and thank you, everyone who's organized, and thank you, everyone who showed up today. I wanted to offer a moment of silence to honor those we have lost to HIV/AIDS and the COVID pandemics. So I just invite you to take a moment to get into a comfortable position and where you'll be able to kind of focus your attention and kind of turn inward for just a minute. So as we start this panel, this gathering of community together, we take a moment to honor those who we have lost. Those who we have lost to HIV/AIDS, those who we have lost to COVID. We remember them, we remember their lives, we honor their lives, excuse me, their lives. We honor their dignity. We honor what we carry forward of them in our lives today. We honor those who died alone. We honor those who died surrounded by family and friends equally. We honor the family, friends, and community who stood by those who were sick and who suffered. We honor their strength, their courage, their compassion. And we call upon those qualities as we gather today to become an ever more inclusive and compassionate community who can care for everyone. Thank you.
Wow, that was really beautiful, Lisa. Thank you. Okay. So today we're going to start with a question for all of our panelists, and you could just pop in whenever you feel inclined to do so. Tell us about your salient experiences with either or both pandemics. And any panelist who wants to respond, please feel free. Oh, Robert, your mic is off. Yeah.
Okay, let me talk about AIDS. I wanted to start out by putting out a disclaimer first. The experience about AIDS that I'm talking about is going to be really the experiences I gained during the 1980s when I was working with people with AIDS on estate planning matters, at least in my practice, and on personal matters outside of my practice. These were people with AIDS primarily in San Francisco. There's so much to talk about that experience, but I wanted to say that I'm going to focus on the first 2 years because those were the scariest times of this epidemic, and they roughly correspond to this period of time that we've been going through on COVID. The disclaimer is that what my experience, I'm not going to be talking about the experience of people with AIDS in other countries. After all, the pandemic started in Africa and then went to Europe and then to here. I'm not going to be addressing them, nor am I going to be talking about AIDS in recent years, or am I going to be talking about AIDS in impacted groups other than gay men, which in the 80s were primarily intravenous drug users, people who needed blood transfusions, Haitians, babies born with AIDS, and female sex partners of straight men, or people with AIDS. What is AIDS? AIDS is the acquired immunodeficiency syndrome caused by the human immunodeficiency virus, the HIV, that attacks the body's immune system. Untreated, the compromised immune system is unable to fight off many diseases called opportunistic infections. The virus is transmitted by transfer of blood, semen, and vaginal fluids. Around September of 1981, when I started work in private practice, the AIDS pandemic had begun in San Francisco, but I and nearly everybody else did not know any of what I just told you about AIDS. No government official or media outlet was talking about the illness. But slowly through the grapevine, I began to hear of terrible illnesses that some gay men were contracting and dying from. We didn't have social media in those days, but some individuals were courageous enough to try to get the word out that something was going on in the community. Probably the most notable of that was an RN from the Concord area who had KS, Kaposi sarcoma. He was the first person with AIDS to come out publicly about his sickness. And he put posters showing his KS lesions in the windows of a pharmacy at the corner of 18th and Castro in the center of the Castro district. What this felt like was you felt like you were living in a horror movie. You were dreading the moment. You knew there was a monster going to be emerging at some point to consume you or your friends. But you didn't know when. You just knew that it was out there and you didn't know what that monster looked like. When I first met my first client with AIDS, Paul Degg, he was a psychotherapist. He was the client who presaged the turn of my work from a general civil practice to one that concentrated entirely on writing wills, trusts, and powers of attorneys and handling the estates of deceased gay men. When Paul arrived, the monster emerged because Paul, a kind, handsome, smart father of a teenage daughter, was the 52nd local man to be diagnosed with AIDS. And when he died in January of 1984, he will be the 149th San Franciscan to die of AIDS. He came to me when he already had Kaposi sarcoma lesions. Our fears were compounded by the fact that none of us really knew how it was contracted. I remember going to a hospital to visit a patient in Walnut Creek and having put in a full hazmat suit in order to visit him. And I remember just rushing home after that to just take a shower because nobody knew how the disease was contracted. There was also and because there was no test, many gay men routinely panicked whenever they saw any kind of skin discoloration, or many of us were just constantly checking our lymph nodes. What I remember most about AIDS was how ugly it was. And the context for this was the time. The 70s were a time in San Francisco that were really the center of the beginning of the gay liberation movement, when lesbians and gay men came to San Francisco to throw off the guilt and the self-hatred that is imposed on them by their families and their communities back home. And in San Francisco, we began to understand that we were neither shameful nor freaks, that we are beautiful and other beautiful people think that we are desirable, and that replacing self-hatred with self-love was essential to the freedom we craved. In contrast, the AIDS pandemic was the ugliest thing I had and have ever experienced. The opportunistic infections unleashed by the weakened immune systems not only confused treating doctors and researching doctors, but ravaged the bodies of young men. In providing the estate planning services to gay men in the 80s, I saw them suffering from these opportunistic infections. Kaposi sarcoma, a cancer that was usually found in those days in older Jews, Turks, and Italians in Europe. It left dark lesions all over the face and body. Many PWA came down with cancers all over their bodies, on their tongues, rectums, or most horrifically in their brains. Many came down with pneumocystis pneumonia, a lung disease caused by a pneumocystis protozoa reproducing prodigiously in a man's lung That protozoa is usually kept in check by a normal immune system, but was a frequent cause of death in early AIDS patients who suffered mightily while gasping for breath. My law partner, Matt Coles, had a client, a young client, who, when diagnosed with the pneumocystis pneumonia, decided to just refuse any treatment for it. And he stayed in the hospital, died alone after 5 days in a really courageous but highly painful death. Then there was toxoplasmosis, a parasite that affected the brain. There was lymphoma. There was unusual and extreme fatigue, as well as the wasting syndrome, where gay men just wasted away to virtually nothing. There was cryptosporidium, caused by a parasite that normally lives in the bowels of sheep. There was cryptococcus, another disease previously found just in bird droppings. Yeast infections in the mouth, shingles, herpes, night sweats. And the most memorable to me was going to visit one of my clients whose leg had swollen up to enormous proportions. And he had contracted elephantiasis. I had only heard of the disease, maybe in National Geographic magazines, but he had that disease. The ugliness was not confined to the PWA's body. Many parents who were told that their son had a serious illness were in the really shocking experience of having to be told that their son was gay and that their son had an illness that was going to be killing them. The shock led some parents to behave in really unfortunate ways. Some of them refused to allow friends and family of the person with AIDS visit him in the hospital. Some immediately took their sons home to wherever they were from, away from any knowledgeable health care, to die, hopefully without anyone knowing about it. Others simply washed their hands of their sons. One prominent gay psychotherapist called his mother to let her know that he had been diagnosed, and her response was, "That's what you get from all that. Why don't you leave the city? You should go to confession." Still others, many others, because their sons feared telling them of their sexual orientation, were never told how seriously sick their sons were, leaving them in many cases to die alone. The ugliness did not stop at death. We handled will contests in which parents refused to comply with the wishes expressed in wills because they refused to believe that their son's primary beneficiary would be a gay man. We were told, my partner was told, there's no way my son would have left his estate to that man. In some cases, without wills, parents took all of their son's belongings, even items that belonged to the partner and their son. And in some cases, tried to exclude the surviving partner from the home.
Robert,
Yes,
may I interrupt you?
sure.
I think it's so important that you're creating this portrait, this image in our minds, that it was extremely painful, ugly, lonely, and scary to have gone through that experience. And
This is a,
I wish that we had more time to just allow
this is a good place for me to stop.
because a lot of people may not be familiar with what HIV/AIDS look like, right? And how obvious it was as a community member to see people dying and wasting and being left alone or suddenly disappearing, and you're not knowing the fate of that individual, although you knew what the fate of that individual was, right? So
This is a good place. This is a good place for me to stop, Eric.
Thank you. No, I just want to honor your experience, and you definitely carry those memories and that trauma with you, and it's important that we pay attention to that, you know. So that's why I think it's really important that you're on this panel. So thank you so much.
Thank you.
Yeah. So I think one of the interesting thing about this panel is that everyone has their own little their entry point into this topic, right? So, you know, some of us have lived through both pandemics, and some are actually working a little bit more in one or the other, right? So, and somebody else want to take it from there and speak from their perspective?
I would love to jump in, flash forward a little bit later. Hi, everybody. I'm Kris Mizutani. I am a registered nurse and a public health nurse as well, which I always forget. Anyway, I started off in public health before I was a nurse, which is sort of loosely defined as the field concerned with keeping populations of people healthy by preventing disease and injury. Medical professionals often try and treat disease while public health workers try and prevent it. So before I knew that I wanted to be a nurse, I worked in the early 2000s on a study as a project assistant collecting data from HIV positive study participants at UCSF in the epidemiology department. So the participants were largely dual and triple diagnosed clients, which means that they either had mental illness, were substance users, or HIV positive. So those were the 3 diagnoses. And they were largely white and African American in the Tenderloin district. And it wasn't because the study was exclusive to whites and African Americans, but that's who was disproportionately being affected by HIV and AIDS at the time in the early 2000s. And then, in the around mid 2000 is when I started working there. So in high school is when the HIV epidemic was blossoming for me. So I wasn't acutely aware of it at that time. I didn't come till about 15 years later to work in the field. So in 2006, the FDA approved the first ever once-a-day pill for HIV known as Atripla. It was a combination of 3 existing drugs. And I think the thought was that taking 1 pill a day was a lot easier than taking 3. And we wanted to see if watching people take their medication every day and incentivizing that would improve their health outcomes, which it did. No shocker there. I won't be surprised if someday there's a once-a-day pill for COVID positive patients that they can take, and we monitor their daily adherence, and we'll see if that helps their health outcomes as well. So right now I work at the SF Department of Public Health. I have 2 different positions. I work in the emergency department, sort of more in that medical model of treating people who are actively sick. And of course, we saw a large handful of COVID positive patients. And then I also work in the city's shelter health system, which is the shelter in place hotel, where we try and prevent people from going to the hospital. And we do everything possible to make sure that, you know, they have access to case management, behavioral health, physical therapy, etc. And I think I have the honor of being able to see the same population in 2 different settings. And I'm going to make a broad generalization and state that I think that because Japanese Americans tend to have health insurance and housing, they're therefore not really the patients that I come to see through our public health system. And just a quick note, I did a little bit of research. The 2019 American Community Survey, which is a survey done by the US Census Bureau, shows that single race persons of Japanese ancestry in the United States, this is 2019 data, make up 0.2% of the total US population. So, and we are currently number 5 amongst the Asian group. Chinese is number 1 in terms of numbers of people who identify as such. So unfortunately, mixed race persons of Japanese descent were left out of that census data. So anyway, leave it to the next speaker. Just wanted to give some perspectives on our numbers throughout the country, 0.2%.
Thank you, Kris.
Thank you.
Mhm.
I'd love to jump in if that's okay.
Absolutely.
Yeah, I just want to appreciate, Robert, what you shared. I mean, that it was a horrible time, right, in the 80s here in San Francisco and across the country. And I guess I'd love to share about the history of my organization that I work at, which was Asian and Pacific Islander Wellness Center. But even before that, it was called Living Well Project. And it was called the GAPA Community HIV Project. And those two organizations merged to become API Wellness. But those two organizations, and actually it was another organization called Filipino Task Force on AIDS. And so there were 3 actually organizations that came that were born in the late 80s. Because exactly of what you were saying, Robert, that there was just, well, first of all, there was just no information about what this disease was that was killing so many people. And different communities had to come together, and in San Francisco, it was just amazing that the Asian and Pacific Islander communities really came together to figure out, we had to take care of our own in many ways, right? No one was taking care of us, like you're saying, like we were hidden and invisible. I think it was very much seen as this white gay man's disease for a long time. And so, but APIs our folks were also living with HIV or testing positive as well. And there just wasn't in that system that even Kris is talking about in the health department, just wasn't an awareness that, how do we support the specific needs of our community, and so, I just feel so grateful that so many folks actually came together to figure this out, and as volunteers, and they, because their friends were dying, as Robert, you painted that picture, and it was our community. And I think, when I was looking, I know that I started at my organization in 1999, but when I look back, in San Francisco, the epidemic, of course, was hitting all different parts of the API community. But, in San Francisco, it's Chinese, Filipino, and Japanese, and maybe Vietnamese and other Southeast Asian communities maybe fall right below Chinese and the Filipino community. But the Japanese community was hit pretty hard, and when I came to my organization, there was a strong, very specific support group for our Japanese community who was living with HIV. We called it Musubi. And it was a very active community and we had staff who would facilitate this support group. And it was a beautiful community. Like I got to meet all of our clients and participate even and help facilitate that group for many years. But I guess I just want to share that, so there was such amazing, our community rose up and took care of our folks, right? So there's that. But I think also what we saw, of course, is that because our families weren't at that time, our biological families weren't, we had to find chosen family, and that was painful in many ways, but also what we needed support around. I think there's a story at my organization that, part of why the communities had to come together is because they actually, as folks got sick, they didn't have any place to put their things. And there was a garage, and I don't even know where it is, somewhere in San Francisco, somebody would know, but there's a garage that they rented because that's where they put their things, because they had nowhere else to put it when they were getting hospitalized, and they just knew that there wasn't going to be a return right out of the hospital. So that story just always, I hold that pretty dear to my heart, close to my heart, as I continue to support the community. And, at San Francisco Community Health Center, we still have very focused programs for the API community living with HIV, but at this point, we don't have very specific a Japanese group or a Filipino group, or other groups. We used to do that, but we haven't done that recently. And I guess I'll share. One thing I do want to share is that just to honor folks who we lost, and thank you to Lisa for starting this with a moment of silence. And maybe I can share it in the chat. This is going to be the 40th anniversary in June of the first diagnosis of HIV. And my organization, we organized there's what's called a names project quilt, or the names quilt, that honored people who died from HIV. And it was because exactly what Robert, you were saying, families had a hard time, right, when they were finding out their kid was gay and had HIV and was dying, and there was such shame in our community around it. But the quilt project helped families to heal and provide and honor their loved ones. We curated a quilt. There's panels. There's thousands and thousands of panels of people who have made quilts in honor of folks who have died from HIV. But we curated eight panels that represented a lot of the community members that founded our organization and died because of HIV. And I'll share that. But you can also see. And I was looking back at it just the other day, and of course the Living Well Project did a quilt. GAPA community, the GAPA is the Gay, Asian, and Pacific Alliance, but they started their own community HIV project. And so there are two quilts in that display that we curated, and you can see, and there are many names in the API community and many JA names in there. And so I'll put that in the chat for folks to visit that when they can.
Thank you, Lance. That it was a question of mine that we're JA LGBTQ folk, or gay men in particular, were getting sick, right? But I didn't know about it. I don't know about their stories, and I don't know what their families had to go through, and what those individuals had to go through. So I'm so happy that your organization and people were organizing. I was mindlessly kind of floating around and trying to avoid contact and living in terror. I came out in 1984, right? So I came out right at the beginning of the crisis. And I think by sheer luck, avoided contact. But up to this moment, this panel, I did not know that our community was organized and under the API umbrella, and also specifically as JA groups. So that's really heartening to know. I just want to share a little something from the chat. Mitt Waltz wrote to Robert, "Thank you for this. I was born 1990, and generationally there has been few times people shared experiences so candidly, and I could never imagine the shift from community liberation in the 70s to surviving HIV." So just want to share that chat. Okay. Lisa, do you want to share?
Sure. Yeah, so I was never actually directly involved in efforts to address HIV/AIDS, but I do remember going to queer API events in the 90s, and there were often safer sex sluts who would go around and share information about safer sex. And I remember being really embarrassed by it and thinking like, oh, I can't handle this. But at the same time, also feeling really grateful that there were people who were concerned about my well-being, who were trying to spread, health information that could protect me. So that's what I remember from that time as a queer woman in the Bay Area. So I'll talk about the COVID pandemic a little bit, and I'll start by just saying, it's been a hard year. It's been a tough time. I work for a national public health organization, and our work is to promote health, safety, and well-being by building equitable communities. and our communities are not equitable. And a lot of the communities we work with were really hard hit, and people have had to really step up from everything from just trying to protect each other from COVID to dealing with economic insecurity and fighting evictions and food security and social isolation and all kinds of things. So it's been a really hard year. Also, it's been interesting as a public health person for the first time seeing public health officials and public health departments discussed prominently in the media. I'm so used to being invisible as someone who kind of works behind the scenes to keep people healthy. But I felt a lot of pride in, these people my colleagues who I really consider heroes in just really working so hard to protect people, even though they were fighting backlash and burnout, and many people having their lives threatened simply because they were trying to protect the public's health. In my personal life, and I really appreciate the opportunity to speak from a personal perspective and not as an expert per se, but from a personal perspective, last year it was the pandemic, the movement for Black Lives, it was California's worsening wildfires, and all of that has really compelled me to really kind of in a deeper way consider my own health and safety and my family's health and safety, and to be prepared for rough times, and I'm really grateful for the various circles and sanghas, people coming together to provide mutual support, emotional support, practical support. And I want to include Omusubi, which I loved hearing Lance that there was a Musubi group. We have a group called Omusubi, which is for queer and trans Japanese Americans in the Bay Area. And we got together, or we get together periodically now on Zoom. There's also a subgroup called Omusubi for Black Lives, and that group has become support for me. We meet regularly to talk about activism and self-love and self-care and community care. For me personally, activism and community building are like the two main ways that I cope with hard things in life. But I also just really want to give credit to Okaeri, because the last few years of being able to turn to the Japanese American community as a source of support has really been profound. To even feel, okay, I'm getting emotional, but to feel that, like I'm worthy of pausing and saying, like, how am I doing? And what do I need? And, that like taking care of yourself isn't just an individual prospect, but it can be a community prospect. I'm used to that in the LGBTQ community, but to do it in a broader community like this is really powerful. So I just want to give credit to that. And I know that, as much as it's been hard, in a lot of ways, I've never felt this cared for and protected and included. And so I feel extremely grateful for that.
Thank you. There's so much there that we could further unpack, all of you guys, in talking about our experiences of first historically, how our community responds, and also the losses that people experience and the disconnection from our family and community and not having access to those resources. And now, talking about we are reconnecting as a community and accessing these resources, more of the things in our community, the JA community, that are so great are now available to LGBTQ JAs, right? In a way that, like Lisa, you're saying, that it wasn't there before. And I think it is a turning point for both of our communities, right? But we need to move on. So This is a question for anyone to respond to. You don't have to. Let's try to keep it a little brief so we can actually get to our final question as well. Okay, so anyone can respond. Based on the United States response thus far to COVID-19, what lessons have we learned from the AIDS epidemic, and what lessons have been partially or entirely ignored? And anyone can respond.
I'd love to go. This is
Sure.
Kris again. Hi, everybody. I think that the investment into the public health system and education is something we've completely ignored as a nation since the AIDS epidemic. In the US, the medical industrial complex really prizes the profit-driven system. Public health stresses the prevention before the medical treatment model. So there's really just very little incentive in a capitalist healthcare system to incentivize prevention. And until we take that incentivization away, we're just going to continue into worsening cycles of, poverty and illness and disease. I think I've said before to friends that, schools of public health are often not the gleaming marble buildings of medical schools. Profit is the driver of care in this country, which in turn perpetuates the lack of access to housing, lack of access to health insurance. In public health, we say that housing is healthcare. So until we, in my opinion, completely flip our healthcare model to include, a way to get us to respond to crises or until we learn to prevent crises rather than respond to them, I think, we're going to continue to have multiple pandemics. And I'm taking a leap here by saying that I think many folks of Japanese descent in this country are educated and relatively affluent. So for me, I think it's imperative that as Nikkei and Japanese that we have an obligation to stand up for single payer and Medicare for all. And I'll leave it to the next speaker.
Lance, do you want to take a?
Sure. Sure. Well, everything Kris said, because I totally, all of that, because that's so critical. Yeah, I was thinking that, like, what lessons have we learned? I was thinking about it, and what struck me, I was thinking earlier today, is just that, when HIV came up, we had this president, Ronald Reagan, who never spoke of HIV, right? We had to force that to happen before until so many people had died. He acknowledged it, and then with COVID, we had this president who refused to acknowledge COVID or take it seriously. Both. So I just feel like in both of these epidemics, we were just behind the 8 ball constantly, and it did damage to all of us. I mean, all of us, of course. The all of us, the big all of us, but for us, I think when you look at what happened with HIV and the stigma with gay men and with trans folks, it was just horrible. And then now with COVID, the backlash against the Asian community is also horrible. Like, it's just, how can we learn, like, how do we look at this from a public health perspective? And so we need leadership. And we, of course, and this is why community, community is so critical. Like that, it's about public health, but it's actually about how do we take care of our communities and each other, and that has to happen in these kind of we have to kind of take care of each other in our communities, and that's so critical. The other thing I want to say is, I can just see now. If there's anything that and then my organization is doing so much around COVID right now, and I just see that the damage that's being done, as soon as we start in COVID, we were isolating and quarantine, right? Isolate and quarantine, and we had to do that because we have to take care of each other. But that's so antithetical to what we had to do. We had to fight against with HIV. It's such a mixed message, right? With HIV, we were like, no, now we have to build community and break isolation and come together and get stronger. And then with COVID, we were like, okay, isolate and quarantine. And it just was like, it was so hard for me to even use those words sometimes. But that's now the vernacular of how we manage COVID, you know, so there's such a disconnect, you know, I just feel like it's, and I do think that that has implications on our mental health, why, you know, substance use continues to impact all of us in our communities. And these are, I think, some of the issues that especially in the, I mean, API community, but in my family, we don't talk about that. It was in my family, but that it was, you know, you kind of cover it up, or you just, there's such a denial and a silence around it. And I just see that even as much as we talk about it at my organization with our clients, you know, last year, one of my dearest clients who I've known for decades, he actually died not of COVID, but during the pandemic, because he was so isolated, and because there wasn't an acknowledgement of his substance abuse issue. As much as my team and I would work with him, it got the best of him during the time, you know, of COVID, when we had to isolate, and as much as we were able to connect with our clients throughout COVID and last year, we maintained services and our doors were open, but we couldn't have the support groups. We couldn't have our drop-in programs, right? We had to limit it to just 5 minutes instead of like a couple hours. And it was tragic to see.
And I would like you to respond to this. A couple of people have pointed out the relative, I guess, privilege that a lot of JA folk have in education and access to resources. But do you believe that it's complicated when you throw into LGBTQ/JA, you know, and how does that shake out for these folk?
Yeah, I mean, I think, well, I'm not sure. I mean, I see that, yeah, I mean, we cross such a diversity of I think, you know, and maybe more of us by proportion, you know, I think maybe have more education or some sense of, or socioeconomic status. But, you know, when I look at, you know, the clients we serve, I mean, you know, we also cross the spectrum, you know, that there are folks who are suffering and because they're isolated and they don't have their connections to family. And this client that I'm talking about, you know, was in his early 50s, my similar age to me, you know, and it was, you know, it was painful. It was hard to see how hard that was. And we have a number of folks who are of the JA community in our kind of client pool, and they're nowhere in, you know, kind of elevated socioeconomic status or educational levels. It's, yeah.
Right. Anyone else want to answer that question? Based on our response thus far to COVID, what lessons have we learned from AIDS, HIV epidemic?
Eric, could I answer that question?
Absolutely.
There are many lessons that we learned or we didn't learn from the HIV one, but I think the overall lesson is we learned that bigotry kills. We learned that it's manifested itself differently in the COVID situation, but many of the reasons that the AIDS pandemic spread so quickly and killed so many people is because the illness, the way that the disease was transmitted was just central to our personal and political identities. And it also lay at the root of society's condemnation of us. And so when you get that combination, not having dealt with any of the society bigotry against LGBT men, the society was woefully unable to deal with the causes and deal with treatment and deal with prevention of the AIDS epidemic. I see the situation as better in the COVID case because the COVID case, the COVID epidemic affects everyone, and the way it's transmitted is not connected to any particularly historically disfavored group. And so I think the way that the bigotry reveals itself is different. It's there, but it reveals itself different. It was central to the whole fight to get services, to get, I mean, just for an example, there was the AIDS, the discovery of the virus to, the discovery of the cause of AIDS wasn't made until February of '84. And it wasn't made until 3 years after the start of the epidemic. In our case, from the very beginning, in COVID's case, from the very beginning, it was clear what was causing it. And within a year, there was a vaccine already. And so I think that speaks volumes about what was going on in the AIDS epidemic.
Absolutely. Is everyone okay if we move on to that final question? And please try to keep your response brief so we can get everybody to contribute who wants to, okay? Final question is, what does our experiences with both pandemics say, in particular, to the Japanese American community, LGBTQ community, and our ability to respond to current and future health crises? Lisa, do you want to?
Sure. I can start with that. Yeah, so you know, my participation in the Japanese American community is as someone whose mother is from Tokyo, who lived in Japan part of my childhood. So just want to name that's kind of my experience in the diaspora that makes up the Japanese American community. So I was talking to my friend yesterday, who her parents are from Japan, and she also spent part of her childhood in Japan, growing up in Japan, and we were commenting on how much the Japanese American community has really worked to preserve the Japanese American culture, including the value of community and this sense of willingness to do what's right for the greater good. Which is really just amazing and lovely and refreshing. So we were really appreciating that. We were also commenting that sometimes that commitment to community and doing what's best for the common good can create some pressure to not do anything that might bring shame to the community, or to do anything that might be considered too outside the norm. And that can create some pressure to be silent or to suppress certain experiences that you think might bring shame or might be too outside the norm. And at the same time, what's really beautiful about the Japanese American community too is that we also have this really beautiful history of activism, which makes me really proud, you know, and honestly, coming back from Japan as an early adolescent, I really struggled with the American kind of protest culture. I was very uncomfortable with activism and protest. Now I really embrace it, and it makes me really proud when the Japanese American community speaks up and stands up, you know, against injustices and for people who are excluded or oppressed. So, you know, when I think about kind of the Japanese American community and how we're responding to the current pandemic and looking ahead to future pandemics, you know, I really hope that we can kind of find that balance between really preserving that commitment to culture and community, and at the same time being willing to talk about things that are difficult and challenge the way things are that we think aren't right or aren't serving the community, because the world is changing. And so we need to figure out how to keep what we want to keep, but also evolve and grow and change at the same time. And I feel like events like this really kind of represent that opportunity to do that as our world changes.
To be a little more explicit, so having this discussion that includes LGBTQ, JAs intentionally is something that may cause people to feel discomfort, but it's necessary for us to expand our ability to take care of each other.
Yeah, and I want to give a shout out to my family. They're not here because I didn't invite them, because if they were here, I'd feel really nervous because they can be kind of critical. But I hope to share the recording. But I do want to give credit to them that, we had really, really bumpy, rocky times in my process of coming out. And yet now they really embrace my queer family. And so, we had our bumps talking about COVID, and I from having gone through hard times, it gives me a little bit more confidence that if I keep at it, we'll figure it out. We'll figure out how to stay connected, even through our generational differences and other kinds of differences.
I love that. I want to be mindful of time. I think we have like 8 minutes left. So if everyone wants to say something briefly to respond to this question, and or your final thoughts, even, it doesn't have to be the question. What was this like for you to have this conversation?
Can I speak?
Sure.
I just want to reinforce what Lisa said. I thought Lisa gave a good balanced approach of what the Japanese American community needs to do. And again, I'm really talking about from the old AIDS experience. The Japanese community at that time was no different from any other community. They did not rise to the challenge. And it was probably expecting too much of them, because no other community was rising to the challenge except lesbians and gay men. Those are the only people that were rising to the challenge. And I think I don't have much contact with the Japanese American community now, except when I go back to Honolulu. And I think those deeply ingrained notions around shame and around filial piety and around obligation have to be examined, because they led to the JA LGBT people, including myself, to be invisible during the AIDS epidemic. They led them to be invisible even if they were not without AIDS. I know a number of people now who were in my high school, or in one case, a cousin of mine who died. He was one generation older than I, but it was only after he died that I knew that he was even gay. I didn't even know he, and so it's, the Japanese American community needs to look at some of its cultural values, because they are very, they weigh us down when we're in a pandemic. They just weigh us down when we're trying to deal with trying to combat a pandemic that is focusing on sexual orientation. It was not the JA community's finest hour, but it was nobody's community's finest hour either.
Thank you, Robert. We could have a whole other conference based on that topic alone. Kris or Lance, do you have anything to add?
I could share. Kris, did you want to share?
Well, I'll go if there's time after you.
Okay, I'll try to be, I'll be quick. What I appreciate, I think there's this theme of shame. I do think there's something about, what we learned from HIV in my family, in our community, that shame is destructive for us. You know, I mean, it's part of our culture, and there's such damage that happened with respect to HIV. It broke down families. It broke you know, it tore apart that structure that we need to thrive, I think. And so I would just say, how can we, and then you know, how can we talk more about our health with each other in our communities, in our families, and do that without shame, or be more open. And that's what I learned from HIV, is that, wow, I need to be able to do that with my siblings, with my aunties, with my, you know, with my parents. So I feel like that is so critical. And I think the other thing is that I've learned from the HIV community, or the work that I do, is that, you know, we need to take care of ourselves, you know, our JA community, our families in that way, you know, but then how do we do that in solidarity with our other API, you know, broader community, and even beyond, you know, communities of color. And I feel like that's something I've learned too through this work, is that we are so small, and we can do, we can actually, in solidarity, actually have more power together. And that's how I found, you know, how we've been able to leverage our connections, and me doing work in other communities on behalf of other communities, so that the return around the support that then the API community gets is actually incredible, you know, and vice versa. There's such a win-win around that. So that's another, you know, what I've been learning and continuing to follow, and guides me in my work, in my life.
Beautiful. Kris, final shots out?
I was just thinking, like, when the Japanese American community wants to stand in allyship and solidarity with other groups, I think we've done a really good job of that. I was thinking back to when I was in high school in the late 80s and early 90s, and there was was it the Gulf War, I think, was happening back then? And I think the Japanese American community really came out to say, no, you know, it's wrong to put people, you know, Muslim Americans into, you know, camps. And I think there was a lot of support for that in the Japanese American community. And then again, now with the detention camps, Tsudu for Solidarity has really come out against incarcerating migrant children. And the Nikkei progressives are doing a lot for reparations for African Americans, and Musubi for Black Lives. So when we want to, we can.
On that note, can you share a little bit about your involvement with the Okaeri Connects?
Oh. Well, I'm gonna have to give
plug.
Well, Okaeri is a group for it was, I believe, started by Stan Yogi and Marcia, and and has been a conference dating back to the mid 2010s. Am I getting this right? I only went to the first conference in LA in 2018. So since then, I've just been completely amazed at how I've been able to sort of blend the straight Japanese American and Japanese community together with my queer, lesbian, gay, bisexual Japanese American community. Because before, they were two separate entities for me, but at Okaeri, it seemed to all just sort of flow with ease, all the groups. And so since then, I decided I wanted to get to know that group a little bit better. And here I am today, organizing with you, Eric, the Okaeri Connects, where we do, I suppose we could say, worldwide Zoom events for connecting people of Japanese ancestry who want to talk about LGBTQ issues and inclusion in the Japanese community. I use the term Japanese and Japanese American as one in this term, in this when I'm speaking now. So yeah.
I mean, I think it is along lines with this theme that we are addressing the silence and the exclusion of a group of people in our community, and it's uncomfortable and it's shameful. It's because of shame that we don't address these people and include them, but then we also feel shame for realizing that we haven't addressed them. So, you know, it kind of feeds on itself. There was one more comment in the chat, and I'd like to share. And somebody wrote, how can we, who wish to be anonymous, how can we talk about these issues in spaces where JA queer folks don't feel comfortable for coming out? For example, many J8 Buddhist temples are asking younger folks to speak more about LGBTQ issues, but many of us feel if we speak on these issues, we will out ourselves. So, there are young people who are grappling with these issues right now. We're all adults and we've moved on in our careers and can do this work with absolute safety and, and a level of comfort. But there are still people, who are going through difficult processes with their families, right? So I think we're still have a lot of work to do. On that note, I just want to thank you all for participating in this panel. I know there's so much stuff that could have been unpacked and we could have gone down many, many, many wormholes, but we'll have to leave that for another time. Okay, so I'm going to pass it on to Stan and Jill now.
Thank you. I just want to see if we have time for questions, a few questions maybe before closing. And I think Michael Matsuno is kind of moderating that process.
We did have that one question that Eric just read. And I also had a question. I haven't seen any others. I was wondering if any of the panelists have seen stigmatization around COVID positive cases probably not obviously in the same degree as with AIDS, HIV, but is maybe that something we've learned from that previous pandemic?
You mean like stigmatization for folks who are COVID positive?
Maybe that doesn't exist.
No, it does. I'm just thinking of like my coworkers who were COVID positive and then who came back once they tested negative and had recovered. I definitely have noticed that people have teased them about like, oh, you shouldn't eat in this break room with us, or, just sort of a lack of understanding of how long the virus stays active. Not trusting that, if they're back at work, then they're probably don't have a high viral load.
I've seen the stigmatization as mostly being self-imposed in the Japanese American community. There are a lot of people who do not like to talk about being seriously ill. I don't know if they feel it's shameful or what, but they don't want anybody to know, and they don't want to talk about it. And that I see as sort of some kind of self-stigmatization kind of process.
And I have seen it in my work, as much as we know and information and we share the research and the data, there starts to be a blame around, when somebody maybe didn't do the right thing, and it really like infuriated me on some level. With my staff, I really had to talk about it at my organization because, and I really rooted it in HIV. I was like, we know what stigma did and how much damage it did. That's our history, and how can we need to learn from it so that we're not blaming and shaming, and I just remember we've done great work. We haven't had so many COVID positives, for the first 9 months, they were all coming to work. No one was positive, but I just knew there would be one at some point. It's just going to happen, and I just kept on sharing that we cannot blame, that person or whoever, and I just had to say it, but I saw it was happening.
Stan, I wonder if people, if they don't have questions, if they have experiences they want to share
Sure, I think there was just one comment I saw come up. Oops, I don't see it now. It's from Janat in Japan, who was talking about, let me see if I could find that. This is from Janat in Japan. We have stigmatization against those who contracted COVID in Japan. They are assumed that they went out, that they were too lazy to obey the rules or not wearing masks. And to me, speaking as Janat, that's not always true. So it seems like that stigmatization goes beyond the US borders. Anybody else have comments or?
I have another question.
Go
If
ahead.
there's time, someone sent to me with the JA community being the go-to group for the quote unquote model minority myth, do you think this has helped or hurt our ability to come out and organize around validating queerness?
Well, I think it's definitely hurt. I mean, my experience is that the model minority meant that you tried to be as, well, in my case, as good a boy as possible. And in a very odd way, it probably helped us from the standpoint of AIDS, because the people who were really out, the people who were just really organizing and celebrating the whole sexual liberation thing in the 70s were primarily gay, were primarily white people. And I think the JA community did not participate in that. I mean, the JA, because it just felt too foreign, partly because it was so white, but partly it was because this is not what a model minority does, to act up. But because we didn't participate in a lot of that sexual liberation thing, we were not as impacted, at least in the 80s. But I definitely think the model minority is one of the things about, I mean, filial piety, shame, and obligation work together to keep us being the model minority.
Mm-hmm.
Robert, I also wanted to share that earlier in the meeting, a lot of folks were really sending a lot of appreciation, and several were calling on you to publish your words, if you haven't.
And I just want to reiterate that, Robert, because I think especially for a younger generation who didn't live through that experience, they don't know that history. And even for those of us who have lived through that experience, it's kind of faded, I think, in many of our minds to the back. So the fact that you still have vivid memories is really an incredible resource.
Well, I have memories, whether they're vivid or not, it's a whole other thing.
Well, they're going to get less vivid as time goes by. So then you give you more incentive to put them down on paper.
I know I painted a bleak picture, but I did want to say one good thing. What the AIDS epidemic did, and it's doing what the COVID epidemic has done. There are a lot of courageous people that have emerged, during those days. When the government wasn't responding, there were particularly women, particularly lesbians, took up the challenge and helped their brothers and provided home care and raised millions of dollars for services that the government was simply not providing. And there were a lot of courageous doctors who did research in fields that it was considered career ending to just be doing a lot of work with people with AIDS or to doing the research on it. And they went ahead and did it anyway. There are just a lot of heroes out there. And it was uplifting when looking back on it to realize that once again.
And I think one of those people is Anthony Fauci. He cut his teeth during the AIDS years during research. Before closing this, I just want to read a comment from Keiko Kubo. It's kind of along the lines of what you just said about people rising to the occasion. Keiko says, I think there were many of us who supported and lived with friends and chosen family who were ill with AIDS back then, kind of reinforcing your point, Robert, that, and Lance, to your point of taking care of our own, and the idea that we can choose our families as well. So I want to encourage you to join me in either using your Zoom emojis or your physical hands to thank our panelists and Eric for moderating this really super interesting and moving and inspiring, I think in many ways, program. And in closing, I just want to share with you, if I can get my screen up again, some announcements. So somebody asked earlier in the chat if there are more programs. There are, and there are 2 more that are part of this Seeing LGBTQ Nikkei series. So one will take place 2 weeks from today, and that's going to focus on trans and non-binary identified Japanese and Japanese American. And then on April 18th, there's going to be a program which will include Michael Matsuno, who's here with us and moderated our Q&A today, about artists and the intersection of creativity, queerness, gender, and ethnicity. So please join us for both or one of those programs if you haven't already signed up for them. I also want to let you know that J-Sei has an ongoing At the Movies series, and there's an upcoming program on March 12th, this coming Friday, and it's going to focus on contemporary Japanese and Korean films, including Shoplifters, which probably many of you have seen, and Parasite, which won the Best Picture Oscar last year. And then along the lines of what Eric and Kris were talking about earlier, Okaeri Connects. These are discussion groups for LGBTQ identified Nikkei family members who are supportive of LGBTQ Nikkei and allies. And so there are 2 upcoming groups on April 11th and May 2nd. So if you're interested in joining us for those groups, check out the Okaeri website, which is listed at the bottom of this flyer. So this is for English language speakers or people who are comfortable speaking English. And there's also a Japanese language group for Okaeri Connects for people who are more comfortable speaking Japanese. So there's an upcoming or 2 upcoming programs for Okaeri Connects in Japanese on March 21st and April 18th. And again, you can check out the Okaeri website to find out more about those programs. So with that, thank you all for spending this time with us. And again, thank you to all the panelists for sharing so openly and courageously about your experiences. And we're going to formally close the program now, but if you want to stick around on Zoom, we're going to informally hang out with each other. So you're more than welcome to stick around and just chat with folks who also stay in the Zoom room. And if you want to leave now, that's fine. Hope to see you at one of our upcoming programs. So thank you all very much.